Hello, dear friends. And today in our series of interviews, the topic today will be stress management during this pandemic, which is a topic which many people have told me is a great concern for them. And about a week ago, I interviewed a psychologist from New York, and today I want to interview a psychologist here from Tel Aviv. But I'd like to open up reading two interesting statements. One of them I mentioned a couple of weeks ago, and I'd like to mention it again just to open up. In Mishlei, the book of Proverbs, so I'll read you first the English because the Hebrew can be a little bit difficult. So in chapter 18 of Mishlei, verse 14, King Solomon says, "The spirit of man will sustain his infirmity, but a wounded spirit who can bear?" The spirit of man will sustain his infirmity, but a wounded spirit who can bear? So the Vilna Gaon translates or comments on this verse in his famous commentary to Proverbs. Ruach ish, what is the spirit of man? It is joy which comes from the spirit. And this is the spirit of man because when a person is in joy, he is able to deal with his infirmities. And even any sickness, heaven forbid, he can deal with it because the simcha, he says, the joy will nullify it. But he who has sadness and depression, how can he deal with anything? And another similar statement I found in Rabbi Dr. Abraham Twersky's little book on Rebbes and Hasidim. He brings a very interesting quote from Menachem Mendel of Vitebsk, which is quite similar to the Vilna Gaon. So don't think that Hasidim and Mitnagdim are necessarily opposite. On the verse in Shmot, Kol ha'machala asher samti mitzrayim, all the diseases which I placed upon you in Egypt, I will not bring upon you, for I, God, am your healer. So Menachem Mendel of Vitebsk, who is very close to Shneir Zalman of Liadi, said, what does it mean, all the diseases? This refers to worry and dejection, because these are the source of all illness. So then, of course, he goes on to talk about this, that the psychosomatic is something which, of course, can influence a person greatly. So both Menachem Mendel of Vitebsk and both the Vilna Gaon says that it's the optimistic view of a human being, the ability to see things in the correct light, which help us deal with the vicissitudes of life, even the mental vicissitudes of life that happen to us at this time. Now, without further ado, I would like to present Ann Borden. She is a registered clinical psychologist, originally from Pennsylvania, worked in the field for about 30 years, and was member of the Board of Psychologists. How do I call it exactly, Chana?
It's okay. Just say I was a psychologist, and I was also a member of the I was a clinical member of the American Association of Marriage and Family Therapists, but I'm now retired.
Thank you. And living in Tel Aviv, and it's really a pleasure, Chana, to present you here so that people can partake from your experience and your wisdom. Bevakasha, please.
Thank you so much. Appreciate that. Actually, what you brought up about talking about how we think essentially speaks directly to how we feel is what cognitive behavioral therapy is all about. I wasn't going to talk about that immediately, but it certainly is a good option. All of the studies show that cognitive behavioral therapy is the one that actually works the best. You can improvise with other therapies as well, but that has a really, really wonderful track record, unless anything's changed in the last few years since I've been retired. The other thing I wanted to address at this point is that is a wonderful tool to utilize. But living in a big city, having lived in a big city most of my life, I find Israel, particularly Tel Aviv, to be a little bit frenetic. And from this, a friend of mine said, Actually, in Tel Aviv, you can always tell the horn seems to be directed to the brake. So people are always just running and going. And all of a sudden, the COVID-19 has changed everything. We no longer run our daily lives, and we're just afraid of what's going to happen because we don't know. It's an enemy that we can't see. It's an enemy that we don't know what to do with. And the fact that we get contradicting information almost daily certainly doesn't help the situation either. Israelis, particularly from my experience, what I've seen and what I believe to be true, is that they're very resilient people. Otherwise, they wouldn't have survived as much as they have with what they've had. But with this, there's no tools. And so one of the things I thought I would talk about today a little bit would be to address some of the tools that we can utilize. You know, everybody saw that young woman, that young mother, frantic, yelling into the screen on a YouTube. Not everybody, but a lot of people saw that mother frantic, yelling into a screen on YouTube, not knowing quite how to handle it or what to do. People are fearful of losing their jobs, they're fearful of losing their homes, they're fearful of getting sick, and they're fearful of making other people ill. So one of the best things I find, and I found in my practice, one of the things that helped a lot was just to deep breathe and to relax. There's certain things that we cannot control. We can control what we can. We can wear masks, we can follow the guidelines that are definitive, but much we cannot control, and it's very hard when we're used to being in control. I would like to also suggest, if anybody has any questions while I'm talking, to please feel free to send them, and Rafi will talk about them. The thing that I would like to talk about mostly is, I think the one thing that we can control maybe is to just do a little bit of relaxation. We can deep breathe it when we get up in the morning. And if nobody has any objections, I'd like to just kind of take you through a quick relaxation technique. I found it very helpful. It's something I used with almost everybody that I saw in therapy. Is there any objection? Anybody raising any objection to this? Nothing? Okay. Well, then let's just start with that. The first thing I would like you to do is just to sit up straight and relaxed, possibly your feet on the ground if you're sitting in a chair. And just breathe out as much as you can. Picture yourself releasing all the negativity, all the anxiety, and breathe out with a whoosh sound. Even you can picture, if you'd like, you can even picture little A's for anxiety and anger, and just picture yourself just breathing it all out to release. And then breathing into the count of 8 slowly, as slowly as you can through your nose. Hold for 4 and breathe out for 8 again with a whoosh sound. Try that a few times and see if it doesn't make you feel a little bit heavier in the chair and a little bit more relaxed. There's no magic in any of this, but it is really, really helpful. When you're running on high energy, it's very difficult to deal with the issues ahead. The other thing I'd like to talk about, if I can try to remember here what it is, you know, not knowing what the future is going to bring is very frightening. If we give into that fear, we've lost. We have to just gradually deal with it day to day. Things are getting better and things are getting worse. Not knowing, again, is terrifying. But it's interesting with what Rafi had talked about in the beginning. As an ex-secular Jew, I learned a lot. And in the Torah, it talks a lot about directly, essentially cognitive therapy, about how we feel. What we think is directly related to how we feel. And there's many studies on this as well. I can't quote any of them at the moment. This was sort of quick to do. So I'm just going to kind of answer any questions if there are any. No questions at all. If there are anything, and if not, I'll just let Rafi ask anything he wants or discuss any area that he thinks will be beneficial.
Well, I will start off by maybe asking something, and that is, can you think of tips to help people manage their stress, whether mental tips or an additional technique? That's really my question here.
Well, you know, the classic is always, you know, meditation. There's some wonderful tapes you can pick up all over. The deep breathing that I mentioned, 8 in, hold for 4, out for 8 is a standard. And just picture yourself breathing in little C's for calmness and breathing out A's for anxiety. That's always helpful. Exercise is a wonderful, wonderful tool that everybody recommends if you're healthy enough to do it. Not thinking about things over and over again. We tend, if we don't release some of the energy that we have, we tend to recycle our thoughts. And so something very, very small turns into a very large issue by the time we're done with it, if we're done with it at all. Sometimes things go on in our brain forever. And that's, one of the other techniques that we can do is when you feel yourself doing that, especially in these times, is to literally just yell stop as loud as you can. Obviously, if there's people in the room, you don't want them to think you're nuts, so you do it in your head. But it's called thought stopping. And that's another technique that I found works very well, is very productive. So you've got the breathing, you've got the thought stopping, you've got the meditation if you want to take yourself through one. You can do relaxation. You can tighten each muscle as you go up and down your body, starting with your toes and going all the way up to your face. And sometimes you don't even realize how tense you are until you start, tense your muscles, count, and then relax. And then you realize how tense you've been. And that's also one of the techniques that are very, very helpful in my experience.
Okay, my next question is, what about mental tips? If a person finds themselves getting a little depressed, are there tips to help you become optimistic? Are there tips to help you try to overlook, encompass the situation to move forward that you can think of?
There's, one of the things is not to let yourself get really, really depressed, because once you're down, really down, it's very hard to pull yourself up again. So your question about when you feel yourself going a little bit down, that's when it's a good time to kind of do whatever it is you need to do. Sometimes that means talking to someone. Often just talking to a friend is sufficient, just so that you don't start that recycle process, where you just keep going and going with the same negative thoughts. We think unconsciously we have an enormous amount of negative thoughts on a regular basis. So we need to work on that. And one of the things we can do is just yell stop and think about something else. I don't care if you're thinking about what you want to make for dinner, or how you want to clean the floor, or anything anything just to stop that process. It becomes like a vicious cycle, and it becomes totally counterproductive. Depression itself is an illness. I mean, sometimes sometimes you can do it by yourself. Cognitive behavioral therapy is a great tool. There's a wonderful book called Feeling Good, the New Mood Therapy. I'm trying to remember his name just blanked out. I hope it's still in print, but I studied under him, and he was an amazing teacher, and he has amazing ideas. Hopefully I'll think about it before we're done. But there's so much on the market. Not necessarily all self-help books. Self-help books are good, but this one is particularly good, and it has a workbook with it.
It's David Burns.
That's it, David Burns, Feeling Good, the New Mood Therapy. And he's excellent. He's at Stanford last time I heard. I don't know where he is now. If he's still practicing, he could be retired as well. So there's a lot that's out there: meditation, exercising, relaxing, and just talking to someone and releasing some of the fear. You don't need to feel the fear. There's also a book out called Feel the Fear and Do It Anyway. That's the other side. Don't live in the fear, but don't recycle it as well. Whatever you need to do, stop that record that keeps going on and on.
One of the problems with the fears is that a lot of it is real. I mean, every day they come out, don't think this is just the flu, it's much worse. We just discovered this, second wave, who knows when it's going to be over. It's very hard for a person to say things will be okay when every day there's some other expert who's telling them how lousy things are.
For sure. And this is something that we've never encountered before, which makes it even more frightening. Israel has sadly been through a lot of trauma and a lot of war, but they know what to do. This they don't know what to do with, and nobody does. And this is where I guess the only thing that comes into is just the meditation and the prayer and the positivity, the optimism. I mean, we can't, learning how to deal with what you can't control and sort of giving up or letting things go. The AA prayer, God grant me the, how does it go? The serenity, the wisdom to accept, the strength to accept the things I cannot change and the wisdom to know the difference, the strength to change the things I can. That's a little bit of what this is about. There's certain things you can't do anything about, but there's certain things you can. Like I said, wear a mask, don't go in, the safe distancing, those things you can control. Worry is something that doesn't serve any purpose. And I know it's much easier to say than do, but it's also the reality, and especially in a situation like this.
I see. How does a person know that they need professional help? What would be the signs or the indications of that point?
Well, one of them, everybody has a down day. Everybody has a down day here and there. That's just human. That's part of living. But if the days don't seem to get much better and it continues to last and stay the same or get worse, or you have suicidal ideations, or you start thinking you don't want to be here, or you don't enjoy the things you used to enjoy anymore, then it's time to check it out and see what it is. There's so much that can be done with that. Mm-hmm. There's so much that's out there, with and without pharmaceuticals. But generally, there's help that's available. And this is, again, a very difficult time because you don't know if you can go out, you don't know who's practicing, you don't know who's working outside. Telepsychology is, pros and cons like everything else. I never did much of it because I was never very comfortable with it. I really feel that you need that face-to-face connection. But some people do it, and at this time it's better than nothing. If that's all we have, it certainly is an option. I'm not as familiar with how the system works in Israel, but I'm sure there's some variables here as well.
In Israel.
So,
Okay. Thank you very much for that. And this is quite insightful. If there are any questions, this is your last chance. People, if you want to write a question. Oh, I see one person wrote, the AA prayer is, God grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. Thank you very much.
Thank that person, yes.
Well,
thank that person.
Kowalski for that. Yes. Well, these are very important things, and I think a lot of people today have been experiencing, people I talk to, friends, family, have all been experiencing these feelings, these down feelings and these feelings of being contained, because especially my sister lives in New York City, who for 4 months, they really have been, for those, I guess, who are watching, who are keeping the rules, to be at home for 4 months, I think can be quite a depressing thing. And,
especially with children, it can drive you nuts, I imagine. And
it can drive the children nuts because they don't want to be at home. And they want to get out and they try to escape and so these are things very, very difficult. Okay, so thank you very much for sharing these ideas with us, and we hope to hear from you also in the future. God willing.
Thank you.
Okay.
Have a good day.
Thank you. Shalom, shalom.
Shalom.